Up next, we have Limitless.
Hello, everybody. As a transgender without health insurance, I had to self-prescribe female hormone, which, as you may know, is estrogen, to develop breast, as part of my male to female transition. Since I was taking this estrogen without doctor's supervision, I always feared the side effect of overdosing, such as liver, kidney failure, diabetes, or breast cancer. Through the course of my transition, I also felt helpless and alone because in order to get medical information, I had to visit so many conflicting and inaccurate websites, but at the end, I just got myself confused with all the information. Even when I do see doctors and therapists, the chances are they think transgender people are freaks, so they refuse to provide friendly and detailed treatments to me, which made me feel the whole medical industry is biased and unfair. In the transgender community, my case is not unique. After studying academic reports and interviewing more than 130 stakeholders, we have found that out of 1.4 million transgender population in the US, 1/3 is either self-medicating, lacking money to see doctors, being abused by healthcare providers, or lost job due to identity. These are some of the major factors causing 5 times higher HIV infection rates compared to US general population. Also, 44% of the suicide attempts in transgender community. And the Medicaid expense of $2 billion every year. After analyzing all the reasons, we found that the major cause for such negative social cost is transgender people are constantly facing the barriers to healthcare and cannot finish their transitions. My name is Hannah. This is Rishabh. This is Victoria. We're Limitless. Today, we're going to show you how our product, the battering ram, can tear down all the barriers and help transgender people finish their transitions.
After analyzing the interviews, there were 2 most common themes. Number 1, lack of reliable information. And number 2, lack of finance options. Our solution, which is a website and a mobile app, will try to solve these challenges and break down barriers. In the medical information section, Hannah can search for different medical procedures she wants. She can look for their description, their cost estimates, their side effects, and where the insurances are accepted. We plan to provide this information by using medical databases such as UpToDate, WPATH Standard, and New England Journal of Medicine to provide trustworthy information. In the medical provider section, Hannah can select different medical procedures she wants and can view a doctor's bio, specialties, which insurances are accepted, and comments from other patients. Folks, this information are available all over the internet, but they are scattered. At Battering Ram, we aim to provide this information at one single space. This is not our unique feature. Our most unique, distinct features are 2. Number 1, the budgeting service, and number 2, the loan services. In the budgeting service section, Hannah can select the medical procedures and legal documents that she wants, and at Battering Ram, we'll provide a total cost estimate and provide a suggestive transition timeline. In the loan options, she can apply for additional funding. She has planned for her transition and have saved some money, but that's not enough. At Battering Ram, she can apply for additional loans. We plan to use in-person, one-on-one consulting services to facilitate loan procedure. We have talked with 4 different medical banking professionals to understand lending practices. We have come up with predetermined factors to analyze Hannah's loan profile and develop a monthly payment plan. Providing loan is very crucial for our sustainability.
Now, we used an iterative design process, testing paper prototypes of our products with experts, our stakeholders, and the attendees at the 2017 Sexpertise Sexual Health Conference. We redesigned to focus on what makes us unique, and that's that long-range budgeting and planning services. There are other products targeted at transgender Americans that do a very effective job of assisting through specific stages of transition. But there is nothing that can assist someone through the entire 5 to 10-year process quite like battering ram. We plan to target trans men and women 18 to 45 years old who make between $25,000 and $90,000 a year. They're likely to pursue more expensive medical and legal transition services, but are still unlikely to have the insurance coverage or savings to pay out of pocket. They'll have the smartphones and internet access to access our platform. There are about 900,000 people in our market segmentation nationwide. We would begin our trial period with the 21,000 who live in Southeast Michigan before trying to move to the state and then the nation. Our sustainability is based on 3 revenue streams. Once we get visibility and a market share through providing that trustworthy and reliable information, we'll begin offering loans. The loan repayments will go back into the pool to provide larger loans to more people. We will also be referring to care providers who will pay an advertising fee. Comparable websites charge between $10 and $100 a month to offer referrals. We'll also pursue fundraising through grants like the Arcus Foundation or the Rainbow Endowments, or private donors looking to support a business run by a trans woman of color. Now, with this seed money, we would focus on development of the website and marketing. We'd hope to have the website done by mid to the end of 2017 and work on collecting that user profile data, surveys from the website, and our metrics to refine both the website and our underwriting models so that we can prepare to roll out loans by the end of 2018. None of this would be possible without our community partners. We've had so much help from a dedicated group of people who are just as committed to ending health disparities for trans Americans as we are. Because together, we are limitless. We have 25 years of combined experience in business, finance, education, nonprofit management, and public health. We have a diverse range of skills, experiences, and identities that make us uniquely situated not only to build trust and empathy with the trans population, but to overcome the barriers they face to safety and happiness. With your help, Battering Ram can break down these walls, because together, we are limitless. Thank you.
Thank you very much. Great presentation. How much money do you need to get started?
Slide.
So we figured it would be around 22,000 for our business operations. So for our business operations, about 10,000, and marketing and hiring grant writers about 10,000, and website development another 2,000.
And where do you think the best source is to get that money?
It's to start with, it will be through grants, because as Victoria mentioned, at first we need to publicize our website and attract customers. So to begin with, it will be through grants.
Great. Okay. Second question is, you're going to start by putting information out to increase the quality of the information available to the community. How are you going to partner with medical experts to bring in that sort of the critical information and any gaps that might exist today?
We have contacts both in the University Spectrum Center and the Comprehensive Gender Services Center, as well as both of the plastic surgeons operating out of the university.
Yeah.
Whose names I do not right now remember, but who said that they would be happy to review any of our information. Stephen Rossi specifically at the Comprehensive Gender Services is one of their social workers who said that he would proofread everything, make sure that we're getting out only the most up-to-date information. Part of the problem is that it changes so rapidly that you have to have someone on full-time making sure you're still giving the correct prerequisites. One of the biggest problems, they said, is people showing up for something they had scheduled 3 years in advance to find out that they were missing a piece of paper that took 6 months to get, and the surgery had to be canceled. So we would keep it up. It would be a full-time job.
Yeah. The trust in the information is going to be important. So hooking in, making sure you have that expertise and budgeted for it is going to be important.
Right. There are a lot of transgender people actually online. They create their personal blog. As they expand this personal blog, the blogs became a kind of full-on website. But those information are purely based on their personal experiences. So we want to make sure that we use the public medical databases like UpToDate and WPATH standard, so that our information quality can be really high.
Great, thank you.
Thank you all. A great presentation, Hannah. Incredibly courageous of you to share your personal story, incredibly compelling story, and thank you for trusting us and trusting this audience with that. It's a two-part question about the loan piece of your model. One, how reliant are you from a sustainability perspective on being able to get a certain volume of loans? And two, where do you think that capital is going to come from? And how are you thinking about pricing it so that it's affordable, but still, again, returns enough sustainable revenue to your business?
To answer the first part, we have come up with some of the factors that we were going to use and assess the character of the loan application. One of the community banks that we talked with, a bank of Ann Arbor, their lending practices is they look at all the financial information, then they invite the person in, and then they talk with that person, and then create a character. And so that character will help us to identify whether that person is capable or not. For example, if the person has planned for it and has savings, that shows us that that person is financially responsible and would be able to repay the loans. So we're going to accept customers that are like high in character and they have a little bit of some kind of a down payment on the loan so that we know even they have skin in the game. To answer the second question, we talked with some of the foundations, and our projection shows that about $250,000 in grant money we're going to lead, and very conservatively, we think that after we start the website, in the year 2, we will have around 10 people to give loans to.
So thank you, team. I really appreciate you highlighting this issue and bringing dignity to the space. Echo Kim's comments. I applaud and laud your courage. Thank you so very much. That being said, less than 1 million people in terms of the market. So talk to me a little bit going back to sustainability. What are the measures of success? And then how do you sustain this model?
So our success KPIs, first of all, to understand whether we are in sync with the customers, we're going to have a survey. So there are 2 kinds of surveys. One is from UCLA. That's a very nationalized transgender survey. And then we're going to make up our own so that we know what we are offering, they are accepting. Other than that, we're going to have web metrics such as number of user accounts, a number of website visitors, and through Google, we can have a click-through rate, a cost per click conversion rate. So we're going to use all these metrics to see whether we are doing what we are supposed to do.
I guess you anticipated that question, huh?
We also use U.S. Transgender Survey, which is being issued every year to measure our impact of our service in transgender community.
Fantastic.
There are almost twice as many Americans under 18 years old that would self-identify as some form of genderqueer than Americans over 18 years old. So we're hoping as they age up, we would have a new user base.
Gotcha.
Also, given the current political climate, they're rolling back every kind of protections, Medicare and Medicaid in general, transition coverage. It's kind of a lifelong process. So even if people have been through most of the majors, it's going to be a constant source of funds and probably horror. So we will have to be there through at least the next 4 years. But after that, plenty of people should be aging up.
I saw a screenshot of your website. There is a login process, so I'm assuming it's HIPAA compliant and privacy is protected?
Yes.
Yes.
That's why we have the login, is because we are worried about people trying to access the information, or since we have something we're thinking about is user comments on the care providers, we want to make sure that those comments are not visible or traceable to someone who doesn't want to say that they are out, that they were visiting that sort of provider. So there are, layers of logins to access our information.
I also just talked to some doctors, and we found that one of the key features that's needed in the medical field is that ability to interact with the patients. So we want to use our service as a middle person, so that doctors can interact with the patients, and then but all the information is still stay confidential.
Great job.
Thank you so much, Limitless. Thank you.